BeautySeek is not a medical provider. This is not medical advice. Always consult a licensed professional.
Stem cell treatment for hair rejuvenation comes with specific expectations. Patients want to understand what results this regenerative approach can obtain, where it has limits, and which scalp conditions benefit the most. Learning the answers to these questions early helps guide confident choices. This is BeautySeek, a network of straight talk about aesthetic procedures so beauty seekers can make confident choices. If you've had a stem cell hair restoration treatment or you perform these procedures, comment or DM us so the BeautySeek community can learn from your experience. We'd love to share your story. Stem cell hair rejuvenation results begin gradually. Information from Arizona Aesthetics shows that many patients begin noticing early shifts between 3 and 6 months. Full results often appear around 12 months as existing hair becomes stronger and the scalp environment supports healthier growth. What changes from stem cell hair rejuvenation can patients expect in the first months? This treatment helps support thinning areas and strengthen hair that is still present. It improves the quality and activity of living follicles, the tiny openings in the scalp where each hair grows. And when follicles are alive, even if weakened or producing thinner strands, they can respond to regenerative support. Stem cell treatment limitations matter. A review in the International Journal of Trichology notes that regenerative treatments depend on living follicles. Stem cell hair rejuvenation cannot create new follicles. A follicle is a small opening in the scalp where hair forms. If that opening no longer exists, no regenerative treatment can make a new one. This treatment also cannot restore density in long-standing bald patches or create immediate cosmetic change in the first months. Stem cell hair rejuvenation candidacy depends on follicle activity. Arizona Aesthetics indicates that ideal candidates are adults with thinning, receding hairlines or early bald spots where follicles are still present. Providers determine this with a microscopic evaluation, a magnified look at the scalp that shows whether follicles are open, alive, and capable of responding. This removes guesswork and gives patients a clear starting point when weighing their treatment options. Stem cell material choices shapes expectations. Arizona Aesthetics reports using stem cell and exosome injections sourced from umbilical cord donors. These biologic materials work through signaling activity, meaning they send instructions to living follicles to encourage repair or support. Because the signals can only act where follicles still exist, knowing the state of your follicles is essential. A helpful stem cell hair rejuvenation question to ask your provider during an early visit is, are my follicles active enough to respond to stem cell hair rejuvenation treatment? And how do you determine that? This keeps the conversation centered on the biology of your specific scalp. Stories from patients in the BeautySeek community who have undergone stem cell hair rejuvenation helps others understand the process of follicle evaluation. If you'd like to share your experience, comment or DM us. When is stem cell hair rejuvenation treatment not the right solution? And what options are available? We'll explore that next, right here on BeautySeek.